So again, Kathy really set us up beautifully on the issue of economic impact. And there's so many layers of the economic impact. We've touched on them. I want to kind of focus our thoughts around it. So it's no longer about the operational aspects. It's not about the efficacy story. It's not about the way in which biosimilars are approved. Let's just talk numbers. And I want to start with, for all of you, and this is almost, I want a brief response and I want to dig in. But you've all described that there's effort involved in the adoption of biosimilars. And it begs the question on an economics argument alone, is the juice worth the squeeze? Who's going first?
I can go first.
Go for it.
I would have to say that in value-based contracts, it will definitely accelerate your ability to get your goal. And therefore, it provides incentives. So with that in mind, I think that we're seeing that it's definitely beneficial.
All right.
I think, we need to look at it from a global perspective, right? If we don't adopt biosimilars, how do you actually make room for more innovative therapies? And, there's been a lot of great models out there which basically show what happens to our cost of medications, biologics, for the next 3 or 4 years. If we don't adopt biosimilars, it's going to go up by $100 billion. And I think that, that should be the biggest reason. But I think that there's so many different factors, that really play a role. Like, it all depends on what type of model your institution is in. If you're at a risk-based model and that's how you practice, then of course you're the provider and the payer. So you're going to be using more biosimilars. But if you're in a revenue generating model, then that is going to drive your decision to use more costly drugs. And as Kathy had mentioned, ASP is important. And this is what actually also influences some of the biosimilar companies not to have aggressive pricing, because they don't want to dilute the ASP so much, because it doesn't make it appealing for providers to use an ASP they're going to lose money on eventually. So I think that there's a lot of economic factors, but I think we need to think about the global picture of, this is the price that we're going to have to pay for adopting, bigger and more costly innovation that we're seeing when, especially in oncology with CAR T cell and the combination of immunotherapies that are coming out. So,
Kathy, is the juice worth the squeeze?
Yes. I think we can all agree that healthcare costs are too high.
But I'm not hearing that when you look at a practice level, the prescriber level, and you look at your contracts and your rebates and drug costs, that at the practice level, I'm hearing differences to the bottom line of 10% or less. Now, are they greater than that? Because for the most part, when I heard about patients, I'm not hearing that patients are seeing a lot of the impact. That in current modeling, current benefit design, that if they've got a $5,000 deductible, they've already hit it by the time they're getting on a drug that's a biosimilar, because they've had surgery, whatever else, 5,000, 10,000, whatever it is, they consumed it.
Right.
And they don't have a drug co-insurance at that point for infusionals. And so, or most don't in design. And so nothing's happening at the patient level. So it's really from an economic preference, it's happening at the practice level. And if that difference is only 10%, is the juice worth the squeeze? Now, if you're telling me it's 20 and 30%, I'm going to, be all ears. But what's that difference?
I do think it's a little more complicated than that. And so, yes, I do think it's worth the squeeze. I believe in the innovation. I believe in the science. I think the cost of healthcare is too high. And when we talk about cost to the patient, yes, okay, yeah, so a $5,000 deductible, I'm not going to argue that. But it's kind of like buying a car at times for people who are already in a financially toxic situation. So whether that's, $5,000 within 60 days, or because of a biosimilar, I can make that not due for, 120, 180 days. It allows them some flexibility, therefore decreasing a little bit of that financial stress to them. Margins are tight in practices. 10%, we see more, we see better. I see, closer to 20. But even 10% is better than 5%. So you kind of, again, it's not just that one thing I'm looking at. I'm kind of looking at that whole larger picture. And I do think as long as we can keep the biosimilar market open and can, continue to increase physician confidence and adoption, I do think that the market will continue to grow, and those advantages will continue to grow as well.
Karina, juice worth the squeeze at the payer level?
Year one, no, the juice is not worth the squeeze. So short game, no. and that's a general statement. You've got some drugs that are worth the squeeze right away. Most are not. So it's really the long game at this point. We're looking at, 3 to 5 year strategy, which is, how we work anyway on our end. But I'll give you an example, not to name any names, and I won't mention any names, but we've had to take several year one losses to be able to make a biosimilar work in year 2, 3, and beyond.